Hello and welcome to today's intervention presentation and capstone video reflection. My name is Wendy Denyu and I have been studying with Capella University to become a baccalaureate prepared nurse. For my capstone topic, I chose an unconventional topic, and that is autism. Autism is a neurodevelopmental disorder that has many underlying cognitive issues and often occurs with other disorders, according to Lord in 2020. I specifically focused on the difficulties that parents and caregivers face in finding available resources to help their children after receiving the autism diagnosis. For capstone, part of our instructions was to create an intervention that would help to benefit our topic of choice, and for the intervention, I chose to create a database specifically pertaining to autism where resources would be available. On a personal level, this topic is near and dear to me as autism runs in my family, and I've seen firsthand the difficulties with finding resources and therapy and where to turn to once you have the diagnosis. On a professional level, I have worked with individuals with developmental disabilities, and I've seen families struggle when they need more help than what they currently have. I do believe that a database full of resources that we as nurses could refer families to would be beneficial not only to the families who are searching for assistance, but also to those of us in the healthcare field that might not truly understand the challenges that are faced by these families on a daily basis. It would give us an opportunity also to collaborate with local resources while helping to improve the quality of care of those we serve while doing so. During this project, I spent many hours with a family member, Christopher, who's gone through these particular struggles after his son Abel was diagnosed. We talked at great lengths on how it was challenging to get the diagnosis in the first place, as referrals and evaluations needed to be made prior to seeing the developmental pediatrician who gave the official diagnosis. After the diagnosis, he said it was as if there were no resources available and he really was unsure of who to turn to. Ultimately, 6 months after diagnosis, he was able to get Abel into a preschool program for children with disabilities after going back and forth with the health department and the local school district, who ultimately determined that Abel should be receiving early intervention services with speech therapy and occupational therapy. In total, Abel spent 1.5 years awaiting diagnosis, receiving his diagnosis, and then starting preschool with therapies. This is astounding considering that studies have shown that beginning early intervention by the age of 4 can greatly affect children and improve their outcomes, according to the Department of Health and Human Services. I shared my intervention plan with Christopher, and he said he couldn't believe that this isn't something already in place in the medical field to provide to parents when a diagnosis is given. He is in favor of this being created so that other parents like him won't have to face as many struggles as he did to get Abel help. This intervention would greatly benefit anyone who is struggling to find resources to help their child. I learned a lot about this topic while I was conducting research. To find credible sources, I went to the library within Capella and used the Summon search engine and filtered articles to be peer-reviewed and no greater than 5 years. This makes sure that sources are credible and relevant to the topic currently. Other sources of information would be websites such as .org or .gov, proving their credibility. For my intervention, I was able to successfully leverage healthcare technology in my capstone project to improve outcomes and communication for those with autism. Utilizing a database is the epitome of incorporating technology with healthcare. In the future, I think that there should be a lot more collaboration with nurses and anyone who has a say as far as the type of technology that comes into the facilities, as we have the firsthand knowledge of observing what works and what does not. As previously discussed in the first parts of this project, there is not one specific organization or government policy that oversees people who have developed developmental disabilities. However, when searching for help and answers, one government source to turn to for information is the Office for People with Developmental Disabilities, also known as OPWDD. In New York State, OPWDD helps to coordinate services for those with developmental disabilities. They have a network of services that include nonprofits, state-run facilities, as well as private facilities. They use Medicaid to fund these services, and approximately 40,000 people in New York alone utilize these services, which include clinical, habilitation, and support services. As a baccalaureate prepared nurse, it's important to understand exactly how these programs function and how I can help refer patients to OPWDD to begin to obtain necessary services. When I started this project, I was worried that autism would be a difficult topic to research, but given that studies suggest that as many as 1 in 59 children have autism, according to Ribeiro in 2022, and given that this is something that I have encountered personally, I wanted to share with others the struggles that go hand in hand with autism. I think I exceeded my expectations on what I was able to uncover and ultimately share with others ideas to make the world an easier place for those afflicted with autism and their families, and truly believe that establishing a database and distributing that information to the parents of a child who is newly diagnosed can and should be best practice. As I reflect back on my time since attending Capella's RN to BSN program, I think that I've grown a lot personally and professionally. I found that in more than one instance while working, I've been able to apply the things that I learned to my daily work. I realize there's so much more to nursing than what we can see, and there is a lot more being done to make sure that patients are properly cared for. On a personal level, with completing this degree, I'm really happy that I pursued it and that I didn't give up, and I was able to set an example for my kids. All in all, I've had a very positive experience in completing this capstone project and also in attending Capella. I thank you all so much for listening, and thank you all for everything that you do. Take care.